Patient gets to see the outcome way before they do the surgery.
But that's only one of the perks of modern dentistry.
Join an oral surgeon from Malaysia
As he explains how digital planning, personalized care, and post-op follow-up help patients prepare for a successful treatment.
Hi, I'm Dr. Batmaraj Rawisandran. I'm an Oral Maxillofacial Surgeon. I'm in this field for the past 13 years. Been practicing the whole range of oral maxillofacial surgery procedures. I'm well versed in dental implantology, and also my special interests are dental implantology and orthognathic surgery. My first visit is understanding the patient, understanding the need of the patient and the need of the treatment. Once I understand the patient's need, then usually we will schedule a treatment plan for the patient. Of course, we are moving towards digital planning. A lot of our planning revolves x-rays, 3D models, and also planning pertaining before and after, so that patient gets to see the outcome way before they do the surgery. Post that, once patient agrees with the treatment plan, usually we will discuss on the cost, on the feasibility, on how many appointments the treatment will require. Then based on patient's feasibility and also availability, we will schedule the appointments. So usually patient testimonial works wonders. So we usually show before after pictures, testimonials from patients, how's their experience, the reviews and feedbacks that we've gotten before. That works wonders. Actually, as basic as running through the procedures, telling them the risk and complication, making them understand the need of the treatment and also the outcome of the treatment, what they are looking for and what they are expected to get, is very important to ease patients' comfort in getting the treatment done. Pain management differs by patient, differs by ethnicity, differs by gender. On the day of procedure itself, options will be given to patient. Very anxious patient, you can do the procedure on sedation, inhalation or IV sedation to put them into more comfort, reduce the anxiety. Then moving on to local anesthesia, removes the pain aspect in pertaining the surgery site. Post-op care is very important. Post-op instruction is very, very important. So I usually emphasize on how the patient takes their medication, how often they have to take their medication, what are the type of medication they can take, what are the alternatives. If they're allergic to a medication, what are the alternatives? If their pain score is in a certain level, what are the alternate medication that we can give to the patient? What are the added medication that are given to the patient? So it's a very patient-specific medication regime. Usually for foreign patients, we'll give them a set of video-guided instructions, what to do, what not to do, and documented listed complication. And with the listed complication, usually it comes along with what to do when patient sees or experience certain complications. And of course, we are approachable any time of the day. They can always contact my colleagues to know to get on hold of me in any issues pertaining post-op complications. But usually it's done virtually. So usually set up appointment through Zoom. But most often, patient is very appreciative, or they get very excited when we give them a video on what are the instructions to be done. Because most often when you talk and explain during the surgery, they will be overwhelmed by the surgery per se. So whatever you explain to them, most often they might not even get the whole picture of it. So they should have something to bring back home, to know, and as a guidance for them to look back into when they have a problem.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.